Hey guys, in today's video, I'm going to be telling you why at-home microneedling is a waste of time and potentially dangerous. If you're new here, welcome. My name is Andrea. I'm a board-certified dermatologist, and I'd love it if you would subscribe to my YouTube channel and give this video a thumbs up. It really helps out my channel a lot. What exactly is microneedling? Microneedling involves the insertion of very fine needles into the subsurface level of the skin with the goal of rejuvenation. Basically, what this does is create little zones of micro-injury that stimulate fibroblasts in the deeper layer of the skin to produce collagen. The end result is an improvement in the appearance of wrinkles. This technique also can be used to improve the look of scars. Because this technique involves making little tiny holes in the skin, it also allows for better penetration of active ingredients and treatments. When done by a board-certified dermatologist, microneedling is a fantastic treatment. It has many benefits, improving scars. It can be used to allow better uptake of topicals for hair restoration like Rogaine, and it can portend improvement in the look of photoaging. Some devices are manual, meaning the little needles always stick out from the surface of the device and they enter the skin as the device is either rolled across the surface or stamped. Other devices use a motor to move the microneedles in and out of the skin, and the physician can, in these cases, control not only the depth of the penetration, but also the speed. Now, don't get me wrong, in-office treatment by a board-certified dermatologist certainly can have many skin benefits for rejuvenation. In office, microneedling is actually paired with something called radio frequency, which is a type of energy that is delivered to the deeper layers of the skin to heat up the deeper layers and further stimulate that collagen production. Microneedling is also a great option for improving the look of cellulite, which there are very few things that help that. So yeah, I mean, it's a great treatment. In office, we like being able to control the depth of the needles. Why? Well, because your skin is not of a uniform thickness. The skin on your nose is a lot thicker than the skin on your neck. And we also like being able to control the speed with which the needles enter the skin, because the faster the speed, the less likely you are to feel it. However, in certain areas like the neck, it's nice to be able to go slower, because the way the neck skin is, it kind of rebounds a little bit. And if you go too fast on the neck, the needles can rebound out and they don't actually penetrate the skin properly. So it's nice to be able to control both the speed and the depth and pair it with radio frequency to deliver that energy to the deeper layers to really boost up collagen production and yield the results that you're looking for. Before you know it, there's gonna be a DIY brain surgery kit on Amazon, because neurosurgeons, they take like an online course for a few weeks, so yeah, sure, we can do that ourselves. Jokes aside, why are the at-home microneedling devices a waste and potentially harmful? Well, first of all, they simply do not give the results that an in-office treatment is going to give. They're not as accurate. You can't adjust the depths, you can't adjust the speed, and there's no pairing with radio frequency. With the at-home self-torture devices, there are two types. There are the DERMAROLLERS, which go 0.25 millimeters generally in depth. So the DERMAROLLERS, they can only penetrate very superficially. They're not going to do the collagen induction like what you would get in office. They're really just kind of picking away at the dead skin cells off the surface of your face, and that's about it. The other type of at-home device is the microneedling pen. Now, these are more terrifying in my opinion because they do penetrate the skin more deeply. They can go up to 2 millimeters. That's pretty deep. At-home devices that penetrate deeply into the skin can cause skin damage. They can cause scarring, infection, post-inflammatory hyperpigmentation. It's very difficult to control yourself as a layperson, the pressure. You may go too hard. That's a very common mistake. You may put too much pressure. That can cause bruising and scarring. Again, some of these devices, they're going pretty deep. The other issue you're going to run into with some of these at-home devices, namely the ones that go so deep, is that you're going to get bleeding. One of the nice things about in-office procedures is A, we're physicians, we know how to control bleeding, and B, it's paired with radio frequency, which actually cauterizes some of the little vessels as we're doing the procedure, so we really don't get bleeding with the radiofrequency microneedling. So doing this at home, depending on the depth of the device that you're using, can cause a lot of bleeding that can lead to crusting and problems for you. Not to mention going that deep can trigger scarring, especially if you're somebody who is predisposed to thick keloids. I mean, I would be worried. I'm worried for you guys if you do this kind of thing. It's also problematic that you can't adjust the depth of the needle because, first of all, as I said, different areas of the body, the skin has there are different thicknesses. So that's important. Not to mention the fact that as humans, there's a lot of variability from person to person in terms of our skin thickness. Men, for example, have thicker skin than women, and different ethnicities have thicker skin than others. And seeing a professional, a board-certified dermatologist, they're going to be able to examine you, take a look at your skin, get an idea of what the appropriate depth is, not only for your skin type and your skin thickness, but also for the indication that you're seeking. So not being able to control the depth is a problem, and not being able to control bleeding with some of these deeper devices is definitely a problem, not to mention scarring and bruising. You're not actually going to be able to truly sterilize it. So risk of infection is quite high. Not to mention, even if you got it completely sterile, one mistake that happens with these is that you can have an area of your skin that has an infection on it. You may not realize it. You roll on over it and basically introduce that pathogen into the deeper layers of the skin. This is a case from the medical literature in which a woman thought she had acne on the chest that she could treat with her home microneedling device. She then treated her face with the same device. Turns out that is not acne, it is shingles, aka varicella virus, and she autoinoculated the virus to her face, hence those lesions there on the face. So yeah, that is an example from the medical literature. So infection is a very real risk with these devices. These are also pretty painful. In office, we can give a prescription numbing cream, lidocaine cream. Now you can buy lidocaine creams over the counter, but they're not as strong, so you're gonna feel this. It can be painful, especially given the fact that you're not going to be able to really control the speed or the depth. The other major issue with the at-home microneedling devices is that they're not gonna remain sharp. You're gonna be reusing the same microneedles from the device, and they get dull, and that is problematic for sure, because you're no longer going to get that puncture that leads to that column of that precise column of injury to stimulate collagen production and whatnot. Instead, you're gonna get tears in the skin, and that can cause bruising, injury, scarring. That also can heal with post-inflammatory hyperpigmentation, which is really problematic for people with medium to deep skin tones. I mean, you can get some seriously disfiguring scarring and hyperpigmentation using these things. They're not like, you know, without harm for sure. The other problem with at-home devices is your skincare products that you buy in the store, or, you know, whatever, Sephora, wherever you buy your skincare products. They're intended to go on the skin and stay there. They're not really meant to be inoculated into your skin. Yes, in office, we might advise the patients to use certain medical, I hate to say medical grade products, but certain products afterwards. But we've kind of vetted those out. However, if you just go and, you know, put your vitamin C serum or whatever, there's so much variability on the market in terms of skincare products. There are certain ingredients in products which should not be inoculated into these channels of injury and put into the deeper layers of the skin. Things like preservatives, fragrance, silicones. I mean, these ingredients, they're benign. I mean, silicones are actually very beneficial in a moisturizer, but you want those to pretty much stay on the surface of the skin. You don't want to be introducing them. Why? The risk of mounting an immune response, an allergy, becomes much higher, and there's a specific type of problem that arises called a granuloma. Here's another case from the medical literature where this woman had actually had microneedling in a med spa, and then they applied a vitamin C serum, and she developed these lesions about 2 weeks after the treatment, and they persisted. Turns out she had a foreign body reaction to the vitamin C serum they had applied. So this is a delayed hypersensitivity reaction, meaning it's not going to happen right away. So in some cases, a patient might not even really realize that it was due to something around the microneedling. I've seen this with these at-home devices, basically inoculation of a foreign body into the deeper layers of the skin. Your immune system starts to wall it off and create this bump in the skin. It's called a granuloma. This can happen, for example, if you get a splinter and it comes out, it can turn into a granuloma, basically walling off. And that is really almost impossible. I mean, it's very challenging to treat. It can be very disfiguring. Another problem with the at-home microneedling is, like, if you go to a derm and you say, hey, I want microneedling, they're gonna evaluate your skin. They're gonna figure out why you want microneedling. They're gonna, is it a specific skin issue that you have, like you wanna improve wrinkles, whatnot. They're gonna evaluate you as a person, and they're gonna help you understand if microneedling is right for you. As opposed to this at-home microneedling trend where it's like, oh, everybody's doing microneedling, I heard it's good for, X, Y, and Z, I'm gonna do it too. Well, maybe it's not the best thing for you. You haven't been evaluated, you haven't undergone that counseling piece. That is key. Some patients are not right for microneedling. Patients who have rosacea or very sensitive skin. Some patients simply are not a good match for microneedling. In office, very easy to do, very low risk of complications, and can and definitely does yield good results. When paired with radio frequency, which is another reason why I just don't get the at-home microneedling trend. Given everything I just told you about all of these potential complications with doing this at home, the fact that no offense, you don't really know what you're doing, you can't assess depth, you can't control depth, you can't control speed, there are potential complications, bleeding, infections, scarring, bruising, hyperpigmentation. The risk to benefit is just not there. And not to mention there's no radio frequency that's gonna be paired with these. So in addition to, increasing the chances of bleeding, you're not gonna get that sustained results. There are too many potential complications that can arise from doing this at home. I just, again, the risk to benefit ratio is simply not there. See a board certified dermatologist for this. That way they can evaluate you. They can evaluate you and have a conversation with you about if this procedure is even something that you need or want. It's easy to believe that you do based on what an advertisement tells you, or, your favorite influencer who's like rolling and scrolling their face. But see a board certified dermatologist, because they can tell you, is this gonna be right for you? What you might expect. And seriously, some people are just doing this because they heard it's good, but it's like, what are you trying to achieve? And that's a conversation you need to have with your dermatologist. When it comes to microneedling, this is not a matter of life or death. It is not a medically necessary procedure, and therefore, what exactly are you doing it at home? Why would you put yourself at risk for bleeding, infection, scarring, hyperpigmentation, bruising, potentially disfiguring outcomes for the sake of a presumed anti-aging benefit? I mean, I made a video a few years ago about microneedling. I'm probably more or less saying the same thing that I said in that video, but yeah, I know this microneedling has gotten even more popular with the stay-at-home orders, and throughout 2020, the sales of these devices went up. So yeah, I don't recommend them, and I think the FDA is actually trying to crack down more on them. That's what I can tell you guys about at-home microneedling. I say scratch it. It's not worth it. And there are a lot of potential harms that can arise from doing it yourself. So I don't recommend it. And I hope this video explains why. If you liked it, give it a thumbs up, share it with your friends, and as always, don't forget, sunscreen and subscribe. I'll talk to you guys tomorrow. Bye.